Welcome back. In today's video, we are doing a brief overview into what Medicare is. Medicare is a federally run insurance program that was originally created to provide insurance for those of the age of 65 and over, and later expanded to those with certain disabilities and illnesses under the age of 65. Today, original Medicare is broken down into three parts. Part A covers most hospital costs. Part B covers medical costs. Part D prescription drugs. Let's start with Part A. Part A covers most of your hospital expenses, as you will have out-of-pocket costs and a deductible of $1,632 as of 2024. The deductible amount can change from year to year and can be met several times in one calendar year. Part A is fully funded with your tax dollars as long as you paid into the system for at least 10 years. Now let's move on to Part B. Part B covers your medical costs, such as general doctor's visits. Because Part B is not fully funded by tax dollars, there is a monthly premium of $174.70 in 2024. This amount can change from year to year. The monthly premium can also change depending on your income bracket. For example, if you fall into a higher income bracket, the premium could be as high as $594 a month. Part B does have a $240 a year deductible, and after that, it's an 80-20 split, where you, the beneficiary, pays 20% of all Medicare expenses. Now for Part D, prescription drugs. There is also a monthly premium for Part D. Depending on the plan that covers your prescriptions, the premiums can range from $20 a month to $110 per month and can change from year to year. In 2024, the premiums have increased. Much like Part B, if you fall into a higher income bracket, there may be an additional premium known as IRMA tax. The IRMA tax can increase the monthly premium by as much as $81 a month. In addition to the monthly premiums, there are also copays, which are paid at the pharmacy when you pick up your prescriptions. You may be wondering if there's a way to help with all the costs, and there is. You can get what is called a Medigap, or known as a Medicare supplement, or choose to enroll in Part C, a Medicare Advantage plan. Both Medicare Supplement and Medicare Advantage plans are offered by private insurance companies. Part C of Medicare. Part C is Medicare Advantage. Medicare Advantage is a privatized version of Medicare. These plans are very similar to what you've had through an employer or individual insurance plan. These plans often have a $0 monthly premiums, and they combine all parts of original Medicare into one plan. They are either HMOs or PPOs. Medicare Advantage plans replace the large deductibles of Part A and the 80-20 split of Part B. The insurance companies have their own schedule of copays. Most Advantage plans do not have a copay for primary care visits and low copays for specialists and lab visits. By law, Medicare Advantage plans must offer coverage at least as good as original Medicare, and the companies often offer coverage above and beyond what original Medicare offers. The plans often offer coverage for things that original Medicare doesn't cover, such as dental, hearing, and vision. As I have mentioned before, there is another option to help with the large Part A deductible and to cover the 20% coinsurance of Part B, and that is Medigap plans, also known as Medicare supplements. Supplement plans are also offered by private insurance companies and do have a monthly premium in the range of $130 to $300 per month. Depending on the supplement plan, there may be little to no out-of-pocket costs, in addition to the monthly premiums. There is also no real networks of doctors or hospitals. You will be able to go to any doctor, any hospital, anywhere in the United States that accepts Medicare. Nationwide, that is about 94% of all doctors and hospitals. Supplements are a great option if you are a frequent traveler. These plans, however, do not cover some needed health benefits such as dental, vision, hearing, or prescription drugs. You will need to buy a separate Part D plan to cover your prescriptions, which on average is between $20 and $60 per month, and if desired, a standalone dental, vision, and hearing policy. If you are wondering which is better, there is no right or wrong answer. With health insurance, everyone has different needs and a different budget. For many people, it's an easier transition to choose a Medicare Advantage because it's similar to an employee-provided insurance, while many others don't like the restrictive feel of the HMO or PPO networks, so they choose a supplement. The important thing to consider is your needs and budget, and do not let any scare tactics or freebie incentives motivate you into a plan that is not appropriate for your individual situation. Your friends' plans may not be right for you either. Our information is below in the description box. Please reach out to us if you have any questions. Thank you for watching.